Every act of service has a story. Every story has the power to inspire. In a world that is always rushing forward, we pause to listen, to learn, and to lead with purpose. Here, conversations go beyond words. They ignite compassion, leadership, and change. This is True Rotarian, where service meets storytelling. I am Hemant Bhasin. Thank you for being part of this journey. Let's begin. Hello and welcome to True Rotarian Podcast, where we talk about stories of service and voices of change. Friends, in the month of March, we have International Women's Day, when we celebrate not only leadership and achievements of women, but also something equally important: their health, dignity, and well being. Because true empowerment begins with awareness. Today, I have a privilege of hosting a distinguished doctor, educator, and a proud Rotarian who has dedicated his life to advancing women's healthcare through innovations, education, and compassion. Dr. Rahul Manchanda is a leading gynecologist, endoscopic and robotic surgeon, head of Manchanda Endoscopic Center, and a passionate advocate for preventive health and menstrual dignity. Friends, he has done 15 preventive health camps with Rotary since 2021, covering 2,400 people, 393 mammograms, and 456 paper smears. Has 152 publications, 299 citations, and over 92,000 reads on ResearchGate. Wow, that's impressive, Rahul. And authored 4 books released in global conferences in Italy, Hungary, and in India. The Indian conference was, in fact, the first conference in Asia organized by Rahul. I'm told he wakes up at 3:35 in the morning every day, does his round of golf, or goes for swimming, and he's in the OT by 8 a.m. Rahul, welcome to True Rotarian Podcast.
Thank you, Hemantji, and thank you for having me here.
Rahul, before we talk about medicine, let us talk about the person behind the doctor. What inspired you to choose gynecology as your life's calling?
Interesting question, though I have been asked that a few times. Let me say we are influenced by our parents. So my mother was a gynecologist and did a lot of work, and I saw that, and I was quite enamored with the work that she did. Plus, when it actually came for me to choose my subject, my specialty, I actually believe, and I looked at all the subjects, and I saw that gynecology involved probably the whole gamut of different specialties. It had the surgical part, it had the looking after the pediatric part, the neonatology part, it had even preventive care for women, what we call the preventive and social medicine. So I got my surgical part. It had the obstetrics, which was delivering of babies, in which you had relationships with the families, literally. So it really, I enjoyed seeing it, I enjoyed doing it, and I thought it was probably one of the most complete subjects out of all the medical subjects.
Wow. Your center carries a legacy started by your mom. How was that shaped your philosophy towards women's healthcare?
More than the center, it's really where I come from, and which is my mother, who was a single mother, because and she got divorced in 1971, when I was literally in her tummy still. I hadn't been born.
Okay.
And we're 2 brothers. So she, in those days where divorce was unheard of, was taboo, much more than what it is now. And so she got divorced then, and she brought both of us up. So we came from, you hear about it being a matriarchal society in the south,
Huh?
but I came from a family which was run by a mother. So we were a matriarchal family. And then eventually, when I went into gynecology, I dealt with ladies, women. So it's just a culture with me. And it's a culture that we had in our family, which made me want to get into this even more so with looking after women's health,
Okay.
which normally women don't take care of themselves. And we tend to keep their health, society tends to keep their health really at the last rung of the ladder. When they should be up right there, but we'll talk about that as we go along.
Yes. Was there a defining moment where you realized that awareness and education can change lives even before the treatment begins?
One particular defining moment, I wouldn't say. But yes, when you go along your career, your training, you realize when you see people coming in, especially in our country, and since I've been now practicing or studying medicine since, and this would be giving away my age, but that's okay, since 1989. So, I've seen people come in situations in last stages of the disease. And that's when you thought, I wish we could have diagnosed this earlier, so we could have managed this and probably saved a life, or at least improved the quality of life for them. That's really when you realize about preventive medicine.
Many viewers and many people may not understand what gynecological endoscopy really means. In simple language, what is it and how has it changed the experience for women undergoing a treatment?
Okay, so let me break it down now for you. So you have gynecology and obstetrics. Gynecology and obstetrics, the obstetrics is delivering of babies, whereas gynecology is women's diseases. So whether she has bleeding problems or cancer or any other thing which is not related to delivering of babies is the gynecology part. Now, gynecological endoscopy is what? It's basically minimally invasive surgery,
Oh, okay.
which means you make small cuts and you do the same operations, same treatments that you would do with large, unsightly, traumatic cuts that you have in olden days, not so old, and you do it through minimally invasive surgery, which means your recovery time, your trauma, your time to get back to ambulation and doing your normal work is reduced amazingly. Just to give you an example, I did a procedure the other day. I was doing a robotic surgery, which is part of gynae endoscopy. It's the more advanced, and I'm sure we'll talk about it. And I had a trainee who'd come from Kazakhstan, and he was sitting next to me, and he saw the surgery. And the next day, I was doing another surgery, and he was there, and he asked me about the lady we operated the previous day, and I told him that she'd gone home after major surgery. So he said, "One day?" I said, "Yeah." Within one day, they go home. And they go home not because you push them out, but because they're able to go home. They're well enough to go home. They walk on their own. So, gynae endoscopy is minimally invasive surgery in women. That means through small holes, which is much nicer, better for ladies.
Now, in the earlier days, surgeries meant longer hospital stays and recovery. What has changed with the minimal invasive and robotic surgery?
Well, you're doing these through small cuts, through telescopes which are literally sort of 5 millimeter or 1 centimeter, 10 millimeter, or even smaller, through the abdomen, like you have gastroendoscopy, which we do your gastroscopy, which everybody knows, looking into the tummy. Similarly, you make small cuts. You put in a telescope, a camera goes onto it, and that throws a picture like on your monitor. And then you see, and through small holes with long instruments, you operate and do the same surgeries.
Okay.
So you see better because now with 3D vision, you can have much more finer, clearer views. The colors are much better, with the cameras that we have nowadays, even for like you're shooting with these cameras. And so the definition, the precision of surgery that you can do, and hence the bleeding and the complications and all are much lesser. And the patient goes home much faster, less trauma, less pain, less bleeding, goes home back literally the same day, if not the next day.
Okay.
And everything comes down. Initially, the equipment was expensive. It still is, but the charges were higher. Now, if you stay, you can compare. If you stay in a hospital for 4 days and you stay in a hospital for 1 day, your cost will automatically come down.
Come down, yes.
So it's
Cost and the inconvenience and the
of
the
course,
kind of
of
trauma
course,
for the
nothing like
patients.
going home and sleeping in your own bed.
Yes.
You recover better, I always feel. Psychologically, when you're in your own bed, you're
Yes.
comfortable, you have your own pillow,
Yes.
So it's definitely nicer for the patient.
Wow. Can you share an example where modern technology dramatically improved patients' outcome?
Yeah, like I said, robotic surgery, which is now the next step after minimally invasive surgery, where you have a robot which actually gives you more degrees of freedom. The vision is much better. I can turn my hand only this much, but a robot can turn it completely 360 degrees. So you have much more precise, especially for cancer surgery. For surgery, something called endometriosis, which is a bane for and a curse for women. Literally, it's not cancer, but it's probably worse than that. And in some cases of cancer, and so your surgeries are much more precise, and your outcomes are better with minimally invasive surgery. And technology, as you said, has advanced so much, and this is the wonder of digital technology, that sitting here, I can actually remotely see a patients who are in the villages. And in our country, it's wonderful because we have this digital infrastructure. We're leading the world in that. So if I'm sitting here, a person who can't come to Delhi and access a specialist's ability to see her can get it long distance, and then we can only call those people who actually need to come.
True.
So it's just the vistas of being able to treat such people and to extend the benefits that they can get, especially in a country like here. You have election, you take ballot boxes and they go right up till the hills and out places, and we can do the same with technology and provide this to women all over the country.
Wow, that's so amazing.
And you can actually operate. Sitting here, there is a facility now that the robot in the other place, I can sit here, so I don't have to go physically to operate, say, thousands of kilometers away. This is something which is the latest thing that has come in. But sitting here on the robot, I have a team on the other side. So I maybe have a specialty or an ability to do a certain type of surgery, and I can't be in 10 places at one time.
Yes.
So sitting here on the console here, it's in a chair, robot is there, I'm able to manage it with my bedside team there and thousands of kilometers away.
Well, that's so amazing.
So this is the next thing, not next thing, it's here, but it needs to be put up to scale now.
Wow, this is beautiful. Now, what are the most common health issues Indian women ignore or delay in addressing?
We've talked about robotic surgery, we've talked about digital innovations, we talked about a little bit about advancement. Let me take you down to the basic, because you talked about the most common, and the most common is something called anemia.
Okay.
Which means your hemoglobin being lesser than what it should be. And do you know, in our country, the WHO normally recognizes anemia is a hemoglobin level of being less than 11 gram percent. But for our country, it's 10 gram percent.
Oh.
So you can see the level of nutrition in our country, and we are actually selling ourselves shorter than the rest of the world. And even with putting that, our level of anemia, and when you have a low hemoglobin, you're liable to other problems, other diseases, infections, malnutrition during deliveries. The children that are born to them are growth retarded. That means they are, much weaker. So many things, and because of that, we lose a lot of lives, and we lose them just because of small thing, which is called a lesser hemoglobin, which is anemia. Now, this can happen in women. quite a bit because of the fact, if I relate it to the bleeding, women every month, especially those in the reproductive age group, have periods, and periods every cyclically you're losing
Losing
blood.
blood, yeah.
So if you're losing more blood, you have to recover that. How do you recover that? By eating well. And we all know that first the elders in the house eat, then the male members in the house eat, then the children, maybe not in that order, and last come the woman.
Yes.
Right? So who gets the least nutrition?
Ladies.
Exactly. So we're not giving her enough, yet she's losing blood, and she's the one who needs most of the nutrition. So what happens? You have lesser nutrition, hemoglobin level goes down, you have anemia, and you're liable to get all the issues that you can have with that.
Hmm.
So bleeding problems can lead to it, and especially because women are having periods.
Any other issues which ladies ignore in the beginning?
In our country, preventive health.
Okay.
Ladies ignore that. Everybody ignores it. And like I said, ladies more so. Because again, the pecking order is senior people, male
Husbands?
members, or husband, or whatever it is. And then you have the children, and then comes the lady in the house. When it should be the opposite, because if the lady in the house
Is
gets
healthy,
unwell,
she'll be able to take better
exactly,
care of the
otherwise it goes for a 6. So they neglect the main problem, like you said, they neglect their preventive health, which means every year you need to go to your doctor, your healthcare provider, get your test done, get your ultrasound done, and get something called a pap smear, which you spoke about our preventive camps that we do. And let me tell you, the camps that you spoke about are what we've done with the Rotary. We've done much more. Rotary is only one organization that I work with, but on our own we've done much more. So Rotary, of course, gives us a platform which I feel is amazing, and your reach is much more. You have people who strength to your elbow, and you can achieve much more in general. So those camps are again preventive health checkup camps that we do, and this pap smear that I was speaking about is a preventive test that all women above the age of 18, 21 should do every year. And I know there'll be other gynecologists there who will say no, but the guidelines say every 3 years or every 5 years. But for me, every year is important. Let's err on the side of caution. Okay? So get it done. And if you tell the ladies to get it every year, then at least they'll get it done every 2 years or every 3 years.
That's right.
So that's the way I look at it. So
Yes.
pap smear will catch problems much earlier, especially cancer cervix, which is the biggest, now the second biggest killer of women in our country.
Yes, and I did a sort of a podcast on cervical cancer some time ago, and we did speak about that.
Yes.
And you said you wanted to speak on this subject a little bit, right?
Yes, absolutely.
Let's go for it.
Okay, perfect. So you've led me into it. Now, you did a wonderful thing, and the lady who was on the show was doing an amazing job, because anybody who does it, I feel, is brilliant. Now, cancer cervix, like I said, till recently was the biggest killer in our country of women. Now it's the second biggest killer, believe it or not. It's still there, and every 8 minutes, every 7 to 8 minutes, one lady in our country dies of cancer cervix, and that's
my God.
cancer of the cervix is the lower part of the uterus, okay, which sort of exposes itself in the vagina, and that is unacceptable according to me. That means this person who's dying has been caught in the last stage of this disease.
And
how
obviously, there is no vaccination taken by them
exactly.
at all.
So how do you prevent it? You prevent it by doing a pap smear, which I said.
Yes.
And you prevent it by taking vaccination.
Vaccination, yeah.
And what I'm happy about is in the latest budget, our finance minister did allude to giving money for prevention of cancer cervix. Now
that's
that's
so
a big
nice.
step.
That's a big step.
And that means vaccination. And it should be made mandatory. It should be put on the immunization vaccine schedule for all our girls, at least. Let's start with the girls. It should be given to boys also. But it should be given to girls, and like the other vaccination that we have, you have the vaccination schedule for all
Yes.
kids. Similarly, this should be put on. It's been done in many of the European countries just by doing pap smears and by doing your vaccination for all our young girls. I have two girls, 9 and 11,
Oh, okay.
going to be 10 and 12. My 11-year-old has taken the vaccine. You
Okay.
give it from 10 to 14
Yes.
before, and then of course up till 45, though I feel you should give it to all women. But 10 to 45 or 9 to 45 is the year age that you give the vaccine, and this will prevent cancer cervix in these girls to the extent of over 95%.
Oh, that's wonderful. I think the WHO has also put a deadline for
Yes.
2030 or 35?
2030, 35.
30, 35. I think so. So to eliminate cervical cancer altogether
Yes.
is basically through vaccination awareness and the
Pap
regular
smears.
pap smear that we were talking
That's
about.
correct.
Rahul, there is another thing that I would like to ask you. Why do women hesitate to seek medical help? Is it fear, social stigma, lack of awareness, or something else? Because this is important.
I'd say it's a little bit of everything, but more so, we are a male dominated society. Fortunately, unfortunately, whatever you want to say. And we do, as our culture, keep the ladies in the house at the end for everything. Let's face it. Until that culture doesn't change, I think it's going to be a difficult, but I do see it changing, and I'll give you a very nice feeling that I have because I started out doing these preventive camps as a private practitioner right from the start. And we used to do, I still do, awareness talks and health camps for women. And I don't, my hospital used to say, okay, let's put, say, ENT with it or something. I said, no, we're going to do it only for women and only gynae because I don't want to dilute it. Okay. So I have seen over the years, say, maybe what was we were doing 15 years ago, um, for pap smears, we would have women coming in, maybe out of 100 women or 80 women, we would have two pap smears. Now, because of the awareness, because of the acceptance, because of whatever you want to call it, we are having over 50, 60 out of 80 pap smears,
Oh, okay.
which is wonderful. It gives me so much joy because, see, also we talk about, and I do camps for all strata of society because what we need to realize is disease doesn't leave anybody. Okay, so whether it's the richest of person or the lowest socioeconomic person, because people look at me and they say, okay, why did you do a camp in, say, a big society? And I tell them and I say, disease has no bounds. Okay, uh, so while I'll do my camps with people of lower socio, I don't distinguish. Okay, so it's nice that across all strata of society, people are now looking at their preventive health checkups,
Wow.
doing pap smears. And a pap smear is a mildly invasive test, okay? It's an examination which is a little uncomfortable depending on who's doing it, but it's a mental block also for women. It's like having a mammogram, okay?
Oh,
It's an
okay.
X-ray of the chest or the breast, but the X-ray plate is pressed a little hard, so it's a
Oh.
little uncomfortable,
Yeah,
and you
yeah.
have this thing that has been made out in society that these are not comfortable tests. But now people are getting them done. Our women are getting them done, and I'm happy because when I see this change, it makes me feel good. It makes me feel that yes, we are changing and we are changing for the better. So if a person gets a pap smear done, I know that at least this one test is going to give us some clarity. We will pick up something if it's there, and if it's picked up, we can at least advise her. She's not
Yes.
sitting on a time bomb,
Yes.
you know. So yes, I see the change and I'm happy, but we are a long way
Long
away
way to go.
from where we should be.
I agree with you. Things are changing. Luckily for me, while growing up, My entire environment was in the forces. My father was in the army. Anybody wearing a forces uniform, they always talk about ladies first.
Yes.
And I'm sure this ladies first syndrome will also come into our villages where they
Yes.
start taking care of the ladies as against, as you said, they are the last priority.
Yes.
It
Yes.
should not happen at all. Now, if every woman watching this program could remember just three preventive health actions, what would you recommend them?
As far as tests go, I'd say get a pap smear,
Mhm.
depending on your age group. Uh, get a mammogram, again, depending on your age group, or an ultrasound. Get all your blood work done, all your tests done. Now, this is as far as tests go. But if I was to talk about preventive general awareness and what to do about it, is definitely, and I put it at the top of my list because I think it's important and it's not followed, which is see your healthcare provider or gynecologist once a year.
Answer again.
Exercise. And don't exercise like you're on the phone and you're walking. No. That half an hour, 1 hour, 5 days a week needs to be taken out
Focused.
for focused exercise and eat healthy.
Mhm.
And when I say eat healthy, don't eat boiled food. I'm not saying diet and decrease the amount of food. I'm saying eat sensibly. That means in moderation, everything is good. Okay, please remember that's something you have to understand. Everything in moderation is okay. Excess of nothing. So if you're like me, try and avoid excess of chocolates because that's what I like. But otherwise, lots of fish, chicken, meat for those who are non-vegetarian. But you can have eggs also, or vegetarian. Lots of paneer, dals, green leafy vegetables for the women, increases your iron. Mix it up with the veggies, different colored fruits. Just have a nice, healthy, balanced diet. That's important. So your diet, your exercise, and going and seeing your healthcare provider once a year, like a bad pill if you have to, but go and see it.
Now, mental health is still a sensitive topic in many families. Why does this stigma continue and how can we change this narrative?
So I'm going to give you another wonderful thing that has happened recently. I talked about the budget, but recently our Supreme Court, last month, I think it was fourth week of last month, passed a judgment where they said that uh, menstrual health and hygiene has been made a fundamental right for
For the
girls,
women.
and they have directed the schools and institutes that they need to make sure that that is done, whether it is by providing biodegradable sanitary pads, giving them clean toilets, separate toilets, and we all know that the biggest dropout rate is for women kids in school, and that's because of not having separate toilets.
Thank God, Rotary is doing a great job in building those toilets in many areas where they do not have toilets for the girl child. I'm sure this is going to be of a great help, and because once you have a separate toilet, the dignity comes back
Of
to the
course,
child,
of
and
course. And you asked about how we can change this. One is, of course, by doing what the Supreme Court has done, sort of on its own, and two is by educating the male members in our family.
Mhm.
We talk about how can we look at women. We must educate the male members. We must make talking about menstruation the norm, normalize it, you know, let it not be taboo. And we were at the Rotary function where I saw you the other day, where we had that singing thing,
Yes,
and my wife was there, and she sang a song on menstrual health
yes,
for
yes.
kids. So, just doing that, and you can see that these things will make it part of the norm. So if you tell the male children in the family that menstruation is a normal thing, it's a normal physiological function of a lady, and it's very important, and it actually means that you're healthy, that's important. So if we make this, normalize this in our own home, start with our own home, start with our own male members. If there's a women's health talk, let not only the women go, the men should go. The men should know what needs to be done for the women. That's important. So make it universal. Tell the men, educate the male children in the family. And of course, you need to do it for the young little girls who are coming up also, to tell
Yes.
them not to be scared. But this is important. Making it a culture, normalizing these things in our society is how it's going to change.
Well, my next question was, what role can parents, school, communities play in normalizing healthy conversation?
By what we mentioned just now.
Yeah.
But having said that, I'll give you another little anecdote. And I used to do these, what we call sexual education talks, under the garb of hygiene talks, believe it or not, in a lot of the schools. And because you couldn't say that, we're talking about this, the parents would object or whatever it was. So I've been to school, colleges, where I would talk about these things which are taboo, and hence try and sort of normalize these things. And it's amazing the misconceptions. And I would do it in a very unusual way, okay? And I'm giving out my secret here, because I would go to the school, and before that I would tell the teachers to ask the kids if they have any questions, then to write them on a piece of paper. If they want to write their name, they can. Otherwise, just write it anonymous. And when you go and you take a lecture, or you talk to them, if you talk to them like a lecture, it becomes very boring.
No, you
You know,
got to
they
have a
don't.
conversation.
So I would take those slips of paper, which were given to me a day earlier, and I would pick it up and I would start reading those questions there and answering them. And before you know it, the ice was broken. And then, of course, they would come up with their questions themselves, and
Yes.
those 45 minutes that I had were not enough.
Wow.
So it's wonderful, but this is how you would bring awareness, educating the parents, bringing them on your side, bringing whatever society is. If you're doing in the villages, you need to have the panchayats and the healthcare workers, or the Anganwadi workers on your side. They're the ones who have already built a rapport with the ladies in the villages. They're the ones who can give you respectability there,
Yes.
And credibility there. So you have to engage all of them.
True. As a fellow Rotarian from Rotary Club of Delhi Premier, which is one of the finest clubs, and I've got very good friends there, actually, uh, I must ask you one thing, that you have conducted many free camps and awareness initiatives. What impact have you seen when healthcare reaches the communities proactively?
Again, they will not come to you. You have to go to them. This is what I believe. It will change hopefully with time. And some of them don't come to you because they can't afford you. They don't have the time. That's the last thing on their list to do. And they will come only when they're on their deathbed. Literally, I'm talking about the women here. Okay? So you've got to go to them. And that definitely makes a difference. And in the beginning, and you'll have lots of people, like in anything that you do in life, who will, poo-poo it and say, okay, so you go there once and you do it, and you come back. But, if something comes up, what happens? Then you put in place things in place where you can actually give them a follow-up. So we actually do a follow-up visit, which we allow them to come. We don't charge them, of course.
Okay.
And I look at it this way, that out of 10 people who come to me, or maybe 100 people who come to me, if 10 people get a positive result, and if I'm able to help one person prevent further adversity, I've done my job.
Yes.
This is the way I look at it.
Yes.
So you might think, oh, you saw 100 patients and only one person is helped. Okay, that's one person less who's going to suffer from infirmity and worse. So I look at it that way. You can look at it whichever way you want to, but that's the way I look at it, and that's the only way to do it, I feel.
True. How can Rotary clubs across India contribute meaningfully to women's health awareness programs?
Well, they're doing a lot, but they need to do a lot more. Give it specially for women, like we're doing. Our club helps us and actually does a lot more. But what is now also, which I think is wonderful, is the cancer cervix program that is now being taken up by Rotary International, I believe,
Yes.
as a flagship program. That I think will be one of the single most things, which is the pap smears, which we spoke about, and the cancer vaccine that we spoke about, will be one of the single most things to prevent infirmity, death in our country, in women, and worldwide. And two things that I would like to say at this point: we have an indigenous cancer cervix vaccine, which is much less expensive, and is made by the same company who provided us with the COVID vaccine.
Yes.
And I think that's wonderful. And that's something that we need to further do for the women of our country.
Wow. What is one small initiative any club can start immediately?
Nutritional health, maybe. Pap smears, like we said. And the vaccine, of course, is needs money, but I think Rotary has the money.
Rotary has the
and
money, yes.
and whatever said and done, I mean, I tell them that, I mean, if you can save a life or prevent somebody from having cancer for maybe 10,000 rupees or 9,000 rupees, I think it should be on your immunization program for the country.
Wow. Now I've got some quick questions for you.
Done.
Let's go for that. Painful periods, are they normal or a warning sign?
A warning sign, a big warning sign. Any amount of pain is not good, but yes, definitely, if it stops you from doing your normal work, interferes with your quality of life, you need to take medication for it. You need a hot water bottle. Big warning sign, red flag.
Go and see a doctor.
Go and see a doctor.
Okay. Is hysterectomy overdosed or misunderstood?
Misunderstood. It needs to be done if there's a proper indication, not otherwise. And you need to have that chat with your healthcare provider who is recommending that. And you need to get your questions answered and see all the alternatives that are available, and then take a proper informed decision. But there should be an indication to do hysterectomy, which I may elaborate for your audience, is removal of the uterus.
Do fibroids always need surgery?
No, absolutely not. Again, there needs to be an indication. They need to be symptomatic. They need to be taken out only if there's a good reason. You see, a woman has many stages in her life, and fibroids are present in different areas of the uterus and are of different sizes also. So it's your gynecologist who will advise you whether they need to be treated with surgery or not, and it'll depend on your symptoms and, of course, you yourself as a person in a whole.
Does menopause mean decline or a new phase of strength?
Wonderful way of describing it. Menopause is not a disease to all these ladies there. It's a stage of life which men go through also, which is later years of your life. But yes, women go through certain issues during that stage of life, as we go through different issues, different stages of our life, especially women, where they need to be understood, where these stages need to be understood, need to be known, so you can deal with it better. And of course, you need the support of the family, which is very important. So menopause is just a stage of life where you will have certain issues which come due to aging, especially due to decline on a hormone called estrogen, which I believe is better than diamonds because it keeps the body healthy for women. and that is something that we need to realize and empathize with all the ladies who are going through this stage of life.
What excites you the most about future of women's healthcare? Robotics, AI, or preventive medicines?
All three, but preventive is first because we're looking at wellness care more than illness care. So you want to cut out the illness and reach the stage where you're well and you can prevent diseases. But AI and robotics will help in that. So AI will help in prevention of women's diseases, like we spoke about, long distance consultations, long distance reading of tests, so that you can sieve out and get only those people here who need to come. Long distance surgery, we spoke about robotic surgery.
Yes.
So that's all there, and they are here, and they can only and will get better. So all three excite me in order to achieve a preventive care for women.
Wonderful. Now, if you could change one thing in India's healthcare system for women, what would that be?
One thing in India's healthcare system, I think just making women the number one priority in all families. So before anybody else goes to the doctor, it's the woman who should go, and that should be made mandatory according to me. If the woman has been for her preventive health checkup, then only will you allow the rest of the family to go.
Or push?
Then only will. Yes, absolutely. And if you do that, make it mandatory, then only I feel, then that will give a big push.
You know, as you know, month of March is where we have International Women's Day. What message would you like to give it to our daughters, mothers, and women watching this program today?
I think every day, first of all, is Women's Day. Though these days help us in actually year marking and doing a little bit more and pushing it a little bit, as you said. The message would be keep yourselves first, is what I would say. Prioritize yourself, because the rest of the world will not do it. You need to do it. You need to take your health, because if you're healthy, only then can you keep, as your nature is, everyone is healthy. And so just prioritize your health. You need to, we talk about me time. Give yourself this me health that you need to do. And the youngsters should push their mothers, and the mothers or the grandmothers should push the youngsters. That's what I would say. Give yourself, make yourself first.
Great. Well, thank you so much for sharing your wisdom and your service with us. Friends, health awareness is empowerment. If the conversation has helped you in any way, or someone you love, please forward it to your friends, share the video, and subscribe our channel. I'm Hemant Bhasin, signing off from TrueRotarian Podcast today. And thank you so much, Rahul.
Thank you, Hemant ji. You're doing a brilliant job.
Thank you.
And thank you for having me.
And ladies and gentlemen, if you also have a story to tell, please do get in touch with us. It will be an honor and a privilege to call you on my show. Thank you so much, and Jai Hind.
Jai Hind.
Thank you.